Peace be to you all. Assalamu alaikum. Omar here. I am a physician assistant / associate, doctor of health education, family man, and moderately fit middle-aged endurance athlete, for those of you guys that don't know me. So I missed doing a video yesterday, so I'm going to try to make up for that by doing one today. We are in the midst of Physician Assistant Week 2023. So for those of you guys that are PAs or future PAs or know of a physician assistant / associate, you can be wished happy PA week or wish that person happy PA week. So today I wanted to discuss with you guys about what a physician assistant does, i.e. what do they specialize in. So in an earlier video I talked about what they do, how to become a PA. So we're physician extenders in many cases. That's what people can consider us. You may hear terms like advanced medical practitioner or mid-level practitioner used interchangeably. Sometimes that's wrought with antagonism and animosity, depending on who's using the term and who's the one receiving it. I just call myself a PA. I'm an older guy. I'm in my mid-50s now, and I've been doing this for more than 2 decades. So my ego, or whatever type of controversy, has kind of left the proverbial building. I just want to live a decent life for however many years I have left, and however long I'm going to work. So PAs can work in any capacity that doctors can work in terms of their specialty. So doctors may just do internal medicine. That's what I do. I work with an internist. I also work with a group of hospitalists. That's where you're in a hospital setting, where you have privileges in that hospital setting. Then you are responsible for a group of patients and kind of oversee their medical care while they're there, while the patient is in that hospital or nursing home. You can also specialize in emergency medicine. There's a young man named Kanan Brown who is a emergency physician assistant. So I'll put a link to his channel in the descriptions. You can also do urgent care. There's some urgent care PAs that are on YouTube doing that. You can do what's called aesthetic medicine. So you're doing things like lip injections, facial fillers, that kind of thing, working usually with a dermatologist or a plastic surgeon. You can do OBGYN, so obstetrics and gynecology. You could do pediatrics. You could do, what else is there? Surgery. So literally anything, anywhere where there's a doctor, a PA can work within that capacity. I don't know of any capacities in which a doctor works that a PA cannot be part of that medical providing team along with the doctor, as long as that doctor or a group of doctors are going to be a supervising physician to said PA. So it's kind of interesting. I've had a lot of different PA jobs throughout my more than 20 years. I've worked in clinics. I've been a college professor. I've gotten to help do research. I've been a clinical coordinator. So, you really, you can kind of search the internet and see what's out there and what PAs are doing. Some people have told me they don't want to do medicine because they don't like blood. Well, and I don't see any blood on my job. I just work with my adult patients, and most of them is treating preventable diseases, so hypertension, diabetes, hyperlipidemia, various joint aches and pains, and I give them referrals to the other specialists, whether that's orthopedics for back, something wrong with their backs or knees. There may be patients who've got chronic pain issues, so I refer them to pain specialists. They may have something wrong with their endocrine system. So I may refer them to an endocrinologist if they've got things like COPD or asthma. There's certain times when I'm able to treat that, but usually the person needs to be referred to a pulmonologist, and that pulmonologist may have a PA that works in conjunction with them. So anywhere where you'll find a doctor, you may find a PA. I think retired neurosurgeon Dr. Ben Carson had a first assist physician assistant working with him, and there's a lot of things out there. We're going to see maybe I don't know, doctors in space. I think one of the people that went into George Bezos' spacecraft was a physician assistant, actually. So that was kind of interesting to see. What else? PAs can they can do research if they want. So if you don't actually want to deal with patients, you can go into lab research or pharmaceutical research. You can work with pharmaceutical companies and work on things like drug development. So really, it's left to your imagination and left to who's willing to hire a PA. I'll talk in another video about how to get hired as a PA. If you're interested, once you graduate and pass your boards, your PANCE Physician Assistant National Certification Exam, and get your license. So it's a pretty exciting career that can lead to a lot of jobs, different jobs. Again, it takes an undergraduate degree, then taking an exam, usually the graduate record exam, the GRE, or the PCAT, getting invited to an interview, then hopefully doing well on your interview, getting accepted, or prayer if you like, getting accepted and getting through. So it's not easy, but to me it's been worth it. It's been a great career. I would not have been doing it for the past 20 plus years if I didn't enjoy it. That's it for now. I wish you guys the best of success in your positive endeavors. If you have any interest in being a physician assistant like me, feel free to reach out to me. I'll leave my contact information in the description section. All right, peace. Take care.